Hello, and welcome to the Tower Hamlets Trauma-Informed Community of Practice. My name's Angela, and I'm a Public Health Program Manager in the Tower Hamlets Council Public Health team. Today, I'm really excited to have some presenters from the Tower Hamlets Women's Commission to talk to us about how they've engaged with residents to help inform policymaking, especially in relation to gender equality. So that's the topic for today, and I'm sure there'll be lots of interesting takeaways and lessons learned from that. So I'm going to hand over to Muslima and Samia to take us away. Thank you.
Thank you, Angela, and thank you as well for inviting the Women's Commission to come and share our work. I was really excited to attend this. And so my name is Muslima. I'm a strategy and policy officer helping work on the Women's Commission. And I'm joined here by Samia. Samia, if you wanted to introduce yourself.
Yeah, so I'm an impact graduate trainee and I'm helping support the Women's Commission's work.
Yeah, and she's also helping with the Women's Resource Centre as well. Okay, so I'm going to share some slides. So if you give me a second and let me know when that comes.
Yep, we can see it.
Okay, I can't see it yet, so it's just loading. Okay, there we go. Thank you, Angela, for the context on the Women's Resource Centre. Okay, so today I'll be sharing about some of the work that the Women's Commission has completed and is going to continue to do. We're still very much in the progress of our work. And so I would love to share with you our methodology, so how we've been engaging with residents to inform, as Angela mentioned, some of the policy work that we're looking to produce out of this. Our respondent information, so who the women were that we engaged with, and some of the key findings from our safety theme. And after that, I would like to have a zoom into some of our areas of learning and so what the next steps are for the Women's Commission, but also from this presentation as well, and some of the ways that anyone that's interested here could be engaged with the work that we're doing. So to start off, I can provide some context on who we are and why we're focusing on the 4 themes that you can see on your screen. So the Women's Commission represents a borough-wide commitment to addressing inequalities for women and really ensuring that women can lead safe, healthy, and fulfilling lives. So we were established in 2024 to investigate and address these inequalities by examining the barriers, the disadvantages and risks faced by women in Tower Hamlets, identifying practical and evidence-based measures to close the gender gap, and to propose a clear and actionable women's strategy that the council, partners, and the wider community can adopt to drive long-term change. So to shape that scope, we held a workshop with residents in June of 2024, and from this workshop, we identified 4 key priority areas that the Commission should focus on. So that's leadership, safety, health, and employment. And then these areas were formalized during a work planning session with commissioners in March of 2025, alongside the use of local evidence. And so, for example, with safety, the emphasis is on gender inclusive design and also feeling of safety in public spaces. And we just had our health sort of findings shared in a public review last week. And this was focused on improving physical health, healthy eating, and pathways to health services as well. So before we, even set out all of this, we needed to have a group of commissioners. And so all of our commissioners are women. They consist of community leaders, residents, and we have a majority representation from Black, Asian, or multi-ethnic backgrounds as well. We did a public recruitment for commissioners, and this involved both resident commissioners and other expert commissioners to be on board. And this really is a developmental opportunity for local women to be informed in, to be involved in informing the key priorities and the recommendations of the women's strategy. And so all of our commissioners are engaged in the facilitation and delivery of our community workshops. They're involved in our formal public reviews, which I'll go into a bit more detail soon. And on the right here, you can see the list of all of our commissioners. So we're chaired by Manzila Uddin, and our vice chair is Sharifa Tissi from Account Free, who I imagine many of us may have met in some way or another. And so I can start off by sharing a little bit about our engagement strategies. And so we held a survey, both online and offline. We had supplementary community workshops, and we had themed community workshops. So this was done to explore the lived experiences of women across these 4 themes. And the survey itself ran for 8 weeks. This was an accessible survey because we offered it both online and in print. We had a simplified version for our ESOL residents. We translated it right now only in Bengali since we didn't have requests for others. But there was also council support to help residents fill out these surveys throughout those 8 weeks. We promoted it across our council comms and to community organizations. And we had 7 stalls in a number of community locations, such as idea stores, such as our children's centers, and other community events that were taking place as well, to help support women basically to fill out this survey and to improve access across those 4 themes as well. Samia, if you want to come in and share a little bit about our community workshops.
Yeah, so another way that the Commission engaged with the community is via community workshops. So to gain deeper insight into the lived experiences of women, we had 2 community workshops for each theme. So the 4 main themes that we mentioned previously, and these were delivered in partnerships with local organisations across the borough. They ran from July to September, and these workshops, they built on survey findings, and they provided a platform for women to share their perspectives in a greater depth. We had overall 118 women participate in these community workshops, and they were held in trusted, familiar settings to ensure that women felt safe and comfortable to speak openly, and spaces were also women only, with officers providing support and signposting to services. So if you want to go next, Muslima. And we also had supplementary workshops. So we delivered a series of supplementary workshops to ensure that women had the opportunity to share their lived experiences and to address lower engagement among specific groups. And these discussions were focused again on all the 4 key themes, so health, employment, safety, and community leadership. And workshops were run in partnership again with local organizations, entrusting that there was trusted and safe spaces for these participants. So we targeted groups like young women, digitally excluded, Asian, non-Bangladeshis, and disabled and LGBTQ plus groups.
Yeah, and just to add, oh no, go on, Samia.
Yeah, accessibility measures, they also included accessible venues, translation support on participation packs, and all women were remunerated with £20 for their participation.
Yeah, just to add as well, this was a really agile approach. So we were monitoring sort of our engagement across our survey, both in person and online, to see where engagement might have been low, and so how we could increase accessibility to tap into the Women's Commission as well. And then, as Samia mentioned, we worked with community organizations to ensure that this was done accessibly. But just to explain a little bit about why we went with these groups in particular, and how this emerged out of our existing engagement.
Yep, can we go next?
Yes. Oh, there's not a slide. Can you see it?
Yep. So in total, our engagement approach reached 303 women who shared their lived experiences with the Commission. So 111 from the survey, the Let's Talk Tower Hamlets survey, 118 from community workshops, and 74 from supplementary workshops. And of these 300 women who engaged with us, 257 shared information about their protected characteristics, which is displayed in the graph below. So as you can see, engagement, we was reflected a broad cross section of women, and there was some overrepresentation in women aged 35 to 64 and underrepresentation for young girls aged 0 to 15. But we did have strong representation with disabled women so we had 33% identifying as disabled and 14% aged 65 or older.
Thank you. And so what's happening now all this engagement is done, and where is it being taken forward? And so these are the formal public reviews that I mentioned briefly in the beginning of our presentation. So we're holding 4 formal public review meetings with partners, with community organizations, with senior decision makers, and with residents across our 4 themes. So we just completed the health one last week on the 23rd, and our first one was community leadership in September. As mentioned, all of our workshops ask residents first and foremost what recommendations they hope to see reflected across the borough. The starting point to all of this discussion is from the residents themselves. And it's a way for us to share the lived experiences of women to senior decision makers as well. Part of the formal public review is for commissioners to lead on a Q&A session with the invited speakers to help A, exchange learning, and B, really address the gaps in some of the barriers or inequalities that have come out of our findings, but also C, to hold accountability to these decision makers about what action and commitment we're having moving forward to inform our women's strategy to be released next year. And so I think if this is a good time to speak on how our engagement and methodology touches on a few of our trauma-informed principles. And so for the first 2, so safety, trust, and transparency, it was very important that each step women were part of conversations that were confidential and anonymized. We had a safeguarding agreement in place before any of the workshops happened, but also that we were in safe and trusted community spaces with organizational presence as well. The context of the commission was clearly communicated before any of our workshops, during and after. And we also ensured that women had voice and choice throughout these workshops too. So commissioners were openly recruited, and they, all being women themselves, are having either some local, as very strong link with the local borough, or being residents themselves. And residents, as mentioned, are involved as the first step in recommendation design. And then lastly, it was important that we collaborated with residents and ensure that the themes that the Commission have set out to really inform was needs-based. So residents were informed in identifying what these key themes are alongside existing local evidence, and for the workshops to be adapted to a number of service users as well. So some of the things that we mentioned earlier was about translations, about changing the style of the focus group, and working with the organizations as well. But I would like to zoom in particularly with our engagement with the community of refugees from Vietnam, and some of the learnings that we gained from this as well. So from our survey, we noticed there was a very significant lack of representation from women from Chinese and Vietnamese backgrounds. And we have, according to our census, we have one of the highest sort of populations of that demographic in our borough as well. And unfortunately, actually, we found that within the council, it was very difficult to find pre-existing sort of relationships that are working with these residents, or knowing sort of who to go to or where we're able to sort of tap in, which we were able to do with other organizations. And so we spent about 2, almost 3 months really building trust with the community of refugees from Vietnam. And the breakthrough was done when we engaged with the Alzheimer's Society. So her name was Adele, and so she's from the Alzheimer's Society, and she already had an established relationship with this community of refugees from Vietnam, or CRV. And she sort of, comes in on a weekly basis and talks about dementia with some of the older women there. And she tends to just like have a stall and speak with them. But as a familiar face, she really helped. That really helped her have a trusted friendship with the women in this group. And so when we spoke with her, we were able to really create an ally to the commission. She really was invested in the work that we were doing and supported sort of our goals as well for the commission in terms of speaking with women from CRV and also informing our women's strategy. And so she was really able to advocate us for the Women's Commission on our behalf to CRV. And she was incredibly active. She was going there every week. She was speaking with Mr. Kwan, who leads CRV, and so just sharing who we are and what the work is, and saying, we're really excited to meet with you. And then over a few months, we were able to earn a bit of trust by the community and then enter the space as well. The second thing I think is quite interesting is that we entered a community venue that was really unknown by the council. So this space is a hybrid madrasa, so like an Islamic Quran school. It's a food bank and it's a community space for Chinese and Vietnamese residents. So if you imagine in your head, it's a real mixture of people in this space. But it's not really promoted, I think, like on our council website, and it was unknown to us as a service as well that a space like this existed, and where men and women from Chinese and Vietnamese backgrounds were coming. And so there was a lot of benefit actually from this space, which I think was quite new for our service to learn about, and that I'm quite excited to share with everyone here. The first one is that it was an incredibly dynamic workshop setting. And this is because the space included a community kitchen. They were running exercise classes in the hall. There were mahjong sessions happening in the corner. There was a social like hangout sofa corner as well. And so people were coming in and out of the space. And that actually worked really well for our workshop. And the reason why is because if we came in and, we tried to make a workshop and said only 10 people are allowed in this private room and you have to attend for the whole 2 hours, I think turnout would have been incredibly low. Because the advantage is that people could attend an exercise class, they could come whilst they're waiting for their, mahjong session to start, and spend in that liminal space about like 20, 30 minutes with their friends as they're waiting and speaking with me. And then when they went back to their, whatever they had planned for that day, they were able to share with their peers, like, oh, I just spent time with Muslima from the council, you should go over once we're done. And actually, this created a really strong snowball effect because that trust was then shared with the other women in that group. And it created an excitement after a while. I think the first 30 minutes, people were a bit curious, but after a while, people were really eager to come in. And I had to say, I'm sorry, I've run out of vouchers. I can't speak. I have to go back. And so that was quite nice as well. It was a bit sad, but it was quite nice that we had so many turn out, much more than we expected. And something else that I think is quite important is that it was really important that we used like peer translators in this setting. So what we've done previously is we would ask an organization like, oh, do you need any translators or interpreters? And we would allocate some budget to cover that cost. But there's a number of languages being spoken here. So there's Chinese, Mandarin, Cantonese, Malaysian, Vietnamese. So that's, at least, 5, 6 languages. And it would have been very difficult, I think, for us to budget for translation across all those 5. But the women themselves, they're multilingual. They're able to translate for their peers. And it was a way as well that we were able to protect the confidentiality of that space because they were sharing it with their friends in a safe setting. And the translations that were happening were people who were also part of that conversation rather than, me hiring someone from an external organization to come in and then translate what was being discussed. And so I think that there was a lot of learning here, which I think is quite important, that these community spaces, as lively and as engaging as they are, really lended itself very well to the engagement that we are trying to achieve. And whilst on paper it looked incredibly different to some of the other community workshops, which, it falls more like a more typical representation of what you imagine a focus group looks like, we were able to get a very strong, I think, representation from women and from these backgrounds as well. And so that being said, I think there was a number of very interesting learning for our findings that I'm keen to share with you as well. especially some of the cultural nuances to the questions that we had. So one of the questions that we asked the women is, do you feel safe in Tower Hamlets? And so all of the women in the group said, yes, I feel safe in Tower Hamlets. And so when I asked follow-up questions about, oh, why do you feel safe? What makes you feel safe? It turns out that the women feel safe because they're incredibly isolated. So they would say, oh, I feel safe because I don't leave my house, or I don't talk to anyone, or I keep to myself. And actually, the reason why they felt safe in Tower Hamlets is because they had a lot of mechanisms in place, which help increase that sense of protection, but also made them feel very lonely and very isolated. And I point that out because if we were to just print out a bunch of translated surveys and hand it over to CRV, 100% of them would tick yes to that question, do I feel safe? And would paint a picture that the women from this community feel really safe in Tower Hamlets, that I think this focus group was able to pull out some important nuances of. We were also able to get some valuable intersections across race and age from this conversation, especially about the fear of xenophobia. I think, unfortunately, especially now, we're seeing a lot of protests that are happening, which the women themselves did speak about as well, and how that impacted the fear that they had within Tower Hamlets and the difficulty of feeling safe in their own community spaces. And a number of them talked about how they felt as a woman and as an older woman, especially the fear of being taken over or someone coming into their space and removing their, what they've set up and built for themselves. And I think that was really important as well as when we consider the power dynamics at play when the council wants to engage with our communities and understanding like some of the barriers that exist to this engagement is really deep-rooted in a lot of historical and social context that we need to also confront and make a safe conversation about. But with all that being said, as positive as this workshop was, there still are gaps that I think is important for us to acknowledge. And the one on the screen I have here is of working women from this group. So Mr. Kwan, the head of CRV, shared that women of working age who are from Chinese and Vietnamese background tend to work 7 days a week and tend to work about 12 to 14-hour shifts. And so something like this really wasn't accessible to them at all. And I think from our service and from the council as well, there's some learning there that still needs to happen about how do we adapt the way that we're conducting community engagement and trying to build these co-produced, strategies or solutions with our residents. And how do we take on board a lot of the barriers and difficulties that working women face as well. Yeah, so that was a very long explanation, but I think this case study really stood out as to some of the important considerations about how we're working with our residents as well. So Samia, I'll share with you to share some of our initial findings from safety.
Yep, so as Muslima was saying, obviously we took away a lot from the community workshops and the supplementary workshops. So some of these workshops, they revealed that women feel unsafe, particularly at night. So one woman said that walking home across Mile End Park, there's not enough lighting, and at the end of the roads, groups of men can be scary, especially at night. So they'd avoid certain routes and areas due to harassment and antisocial behavior. Women have also experienced harassment and fear, particularly again from men in groups, and they would adjust their behavior or limit their mobility accordingly. So one woman said that if she had to go out at night, she'd only go by private hire car because the long intervals between what used to be a frequent bus service means that you have to wait for a long time in dark areas. So that was a few of the findings, and I'll give it back to you, Muslima.
Yeah. So women also talked about a lack of police presence, and they called for an increased and responsive and supportive officer presence as well, clear guidance on how to call for help, and trauma-informed support to feel safer when reporting incidents. Women also want to be actively involved in designing safer spaces and these services that are put in place. They advocated for more consistent engagement, but much greater representation in decision-making processes that are delivering these changes. And I think this really stands out when we when we talk to women about having a much more proactive role in ensuring their own safety. And so existing strategies such as, for example, avoiding dark areas or carrying a whistle with them, or always going in pairs, which a lot of these strategies that women are already sort of using, felt this just wasn't enough that meets their safety concerns. Samia?
Yep, so now looking at the next steps. So we've done the resident engagement, we've completed those. So that included the surveys, the community workshops, and the supplementary workshops. And we are currently in the process of continuing our formal public reviews. So we've just finished one last week, and we've got two left, and these will inform our recommendations that we make. And in the future, we will have a scrutiny committee spotlight, which will be an overview of our engagement as a whole, receiving feedback on existing and future work. And in 2026, we are looking to launch our strategy, which is the Women's Strategy Report, and we will have a launch event with key stakeholders across the borough and residents as well.
Thank you, Samia. So as mentioned, we're looking to launch our report in 2026, and that's our next steps. But I thought it would be a nice way to end this presentation about how, if you're interested, how you can also be part of our next steps. So we have our steering group, which everyone here is, you may be able to join. So we meet every 4 weeks on Wednesday mornings, and the purpose of these steering group meetings is to help raise sort of to share the work that we've done and to ensure that there isn't duplication across the service, but also by community organizations as well, and identifying where we can collaborate and join up, especially when it comes to some of the recommendations that are coming out. And in the future, we're looking to really strengthen that function of the steering group in order to be involved in the delivery of these recommendations. So if that sounds something like you're interested in, please do share your name and contact details in the chat. Samia will be sort of taking that into our list, and then we can let you know of further details. We also have 2 more formal public reviews. So the next one is on employment. That's happening on the 17th of November at Bethnal Green Library for 10 a.m. And then our last one is on safety. And so that's happening on the 9th of December. It's hybrid, so you can join in person at the town hall or online. And it'll be starting after work at 5:30. And then lastly, we also have a mailing list. So if you just want to be sort of informed about what we're doing and when our report is being launched, then likewise, please share your details in the chat, and we'll be happy to add you to our mailing list. But there we go, that's our presentation. So thank you for inviting us to speak, and we will be happy to answer any questions. Thank you.
Thanks so much, both. Really, really well done. It's clear that, I don't know, there's so much to take away from what you've presented, and I know that there's a lot more because you've only focused on one of the kind of pillars there. But yeah, just to say congratulations on the project so far. I have an initial question just for people to know about, but maybe you'll send links after. For the public reviews, are they being recorded and hosted anywhere for people to access?
So for 2 of them, we're recording the sessions, so the ones happening at the town hall. But for the 2 that's happening in a community venue, we're sharing all of our slides and we're taking minutes. So everything
Okay.
will be on our webpage, and we're looking to update that in the coming days. So I'll drop a link in the chat so that you can have a look at that. But yeah, our leadership one is up on the website already, so that'll be good.
Oh, great. Yeah. I did tune into that one online as it was happening, which was
Thank
very
you.
interesting. So people will find it an interesting watch, I'm sure. Great. Well, I will open up to the floor for any questions or comments. I think I saw a hand flash up and down from someone. While you're thinking about it, I have another question, which was I was curious to know more about for the commissioners that you recruited. Was there like a training that you had to do to kind of get people all on the same page? Because I imagine that they're coming from different walks of life.
Yeah, I think so you're completely correct. The women that we recruited are from a real range of backgrounds, but that was very intentional. So I think that lended itself to a lot of the strengths of the commissioners in terms of the real range of skills and expertise that they were bringing into it. In terms of training, so this was done. So we haven't provided any training for the commissioners, but we do have quite regular support mechanisms in place to help bring commissioners together. So there's a lot of guidance and support for commissioners. We have regular check-ins, but also they're very heavily involved in the design of what the Women's Commission looks like and how actions are being taken forward. So I think in terms of the range of backgrounds, it's represented quite well in how, as a commission, we're responding to the needs of women. So I think that that's an interesting thing that you pointed out, Angela. Yeah,
Okay, that's helpful.
thank you.
Questions from the room? A comment in the chat, I'll just read it out. Really interesting to hear about all the things you did to access different communities in Tower Hamlets, especially historically vulnerable groups. A huge barrier to access for many of our services, so always useful to have ideas for how we can work differently. I totally agree. I think the example that you gave with that case study was super interesting, and I think especially because we can tend to be quite rigid with how we plan things, and there's a reason for that just in terms of our ease, but it really speaks to the whole, like, the terminology hard to reach versus we're not working hard enough to reach people. So yeah, I thought that example with that community venue was really helpful to kind of spell out. And then there's an ask there for the mailing list. I don't know if you have a form or if maybe it's on the webpage that you shared already.
So if you share your just name and contact details, Samia will be taking that on board for the mailing list.
Yeah, I just wanted to clarify. I think she mentioned about the center as well. So I just wanted to clarify the Women's Resource Centre is separate to the Women's Commission,
Mm.
but a lot of the work that the Women's Commission is doing does obviously go hand in hand with what the Women's Resource Centre is doing. So if you're interested in that as well, I could send you details regarding that too.
Right, I guess some of the, or a few of the main themes around safety and health and employment, they're
Employment,
going to be
yep.
hosting different services that can be
Mm-hmm.
at the NARI Center.
Yep.
Do you know the opening date for that, or
So
when
we've not
the
got a confirmed date, but a
fine?
preliminary date is set for the end of November. So hopefully
Got
when
it.
we've received that information, it will be shared.
Great. Perfect. Um, if it's okay, I have a few more questions.
Go for
Maybe it
it.
will inspire others. I had a question about the participation packs that you prepared for people that were attending the workshops. Could you say more about what you helped to for people to participate?
Yeah, of course. So all of our participation packs included all of the questions that residents will be asked. So they knew all the questions beforehand. And the expectation wasn't for them to enter the workshops with done any sort of pre-learning or any pre-work. It's just so to help sort of reduce any anxiety or concerns about the questions that are being asked, and also help empower them to choose, like, if there are any questions that they don't want to be engaged with, they don't have to share anything that they don't want to. And that was responded to quite well. And this was all printed on the day. Other information that was included was just some context about who we are, why we're hosting this workshop, where the information is going, and how we're ensuring that everything is being done confidentially, and who to contact, like if you need any support, if you have any questions. So it was only about sort of 2 pages long, but it included sort of really important context for the women sort of before attending, and it was a good touch point during the workshop as well. Where we could help signpost them to sort of some of the key, like, frequent questions that have come out, especially around confidentiality and safeguarding. I think residents found it quite reassuring, and this was also translated where needed, and we ensured, like, all of it was done in very simple, plain English, so that it could be shared by the organizations. Yep. You're on mute.
Thank you. Just another question from me while people are brewing away. I wondered if, because Tower Hamlets is also quite diverse in terms of like people's socioeconomic background too, and I wondered if you felt like the representation of people from kind of different walks of life as far as like I know you mentioned it was not that easy to reach people who are working during the day, but did you find that you were hearing from people that like have professional jobs and that kind of thing as well, because that is also a demographic in the borough?
Yeah, that's a really valid question. So for our survey, we do have that intersectional data. For the women who disclosed it, they did share. So if they were working, or sort of what their economic activity status was. For our community workshops, we only focused on the three protected characteristics. So that being age and being caring, any caring or disability, and also the ethnic group. We wouldn't have that data for specifically our community workshops, but I can share that from our finding itself, because we engaged with local organizations, we did have a solid representation across different economic status. So there was a number of women who were employed or unemployed, who were just sort of were volunteering versus people who are a lot more maybe senior sort of in their position. I think that the questions themselves, however, didn't really interrogate some of that background. So the questions didn't assume that women were from a specific background. So it didn't come up very naturally in conversations, unless, for example, with the employment one, it did come up in the sense of any responsibilities that women might have alongside their roles, so caring responsibilities or any accessibility needs that they might have. I think that if there's something to be pulled out there in terms of that intersection, it could be something for us to consider for our report and see if there are any trends that we're able to see. But yeah, does that answer your question, Angela? Sorry.
Yeah, it's really helpful. I guess like the other end to that is also people that are kind of, living in very precarious situations
Yeah.
financially, and like obviously very important to hear from those situations as well. I think that was
Yeah.
something that was coming up in when we've been discussing stuff related to the New Romans Resource Center, how to cater to so many different needs in the same room as well, especially where there's issues like if someone is using substances or if they're like also in other kind of challenging situations. Amanda, do you want to come in?
Oh, only if you finished. I was just sort of thinking about how this project could sort of work with and support sort of women who are facing homelessness. I'm just thinking about some of the projects that are ongoing, because we do find it's sort of very much, women are very much underrepresented in the sort of rough sleeping figures because they tend to sort of hide away in really hidden places, and there's sort of many barriers to them engaging with support services, and we're looking at sort of how we can sort of make it have maybe more women only services and where they can be held and what they'd look like, and we every year there's a women's census, which sort of is a questionnaire for people that are homeless or rough sleeping, but not necessarily what we call verified, so they're not being seen by the outreach teams, and the challenges they face around sort of, I'm thinking about your sort of themes of safety and health, and employment. Yeah, definitely. And potentially those ladies that are in housing, but maybe are more likely to face things like cuckooing or domestic violence. Yeah, I've got lots of thoughts going on, but so I'm going to put my email in the chat so I can be part of the the mailing system.
Yeah, thank you, Amanda. So to respond to your point, Angela, as well, which I think Amanda also touched on, I think that like just from our findings, we did have a reoccurring theme about a lot of the challenges that women have, about like the cost of living crisis, about housing, about having feeling safe as within the community. And I think whilst representation for rough sleepers was very low, there was a few conversations that came out of our safety community workshops that did touch on this. I think that across all four themes, income and the need for more funding and more financial support was very strong across across all of the questions that we asked with women and the conversations that we had. I think just in terms of the equality monitoring data that we pulled, it wasn't specifically asked outside of the survey. But I think in terms of the qualitative data that we have, that there is significant findings that come there. And Amanda, it's great to hear already that you're thinking about a number of ways that the Women's Commission could tap into this. And yeah, if you do share your details, we can let you know about what our future activities look like. And yeah, I can take that back to my team as well about the rough sleeper population too. Thank you.
Great, thank you. And yeah, it sounds like there were still really insightful findings from it. We can start to draw the session slowly to a close, unless people have any new questions, but I'm just going to remind you of or resend the link in the chat for the feedback form. And yeah, keep putting email addresses in the chat if you want to be on that mailing list. But I suppose we have two more sessions to look forward to from the Women's Commission if people want to attend those. So when I'm sharing the slides that you presented, I'll pick out the dates in case people want to come along to that. And yeah, I'm really excited to see more of the findings and also to hear about how the strategy gets developed. Thank you for putting the Eventbrite in the chat. Happy to share that as well with the email that goes out, because I know sometimes people aren't able to attend this, but they still read all the emails, which is helpful for me. But great, thank you both so much, and really well done on the work that you've done. It's really impressive and quite a big feat as well. So you should be very proud.
Thank you.
Thank you. Thank you so much.
Thanks everyone for coming along. Have a good rest of your day.
Bye.
Thanks,
Bye.
everyone.